This is One on One. Hi, Steve Adubato. More importantly, this is the New Jersey Nurses Association, the Epic Awards, and we're here with the CEO of the Nurses Association, Judith Schmidt. Judy, what are, in fact, the Epic Awards?
The Epic Awards are an award that we give as nurses to exceptional people in the community. We like to honor those non-nurses and some nurses who have gone out of their way to make sure that the community has the services that need in relation to health care and social services.
A whole range of people are being honored. Governor Tom Kean being honored, Dr. Ann Prisco from Felician, their great nursing program, and so many others that are being honored tonight. Let's talk about this. We've talked before on the air, on public television. You've been with us. But the role of nurses changed dramatically over the years. But advanced practice nurses, so important. Why? What are they and why important?
Well, advanced practice nurses are nurses who have attained minimally their master's degree. Most often they have doctoral degrees in nursing practice. They're also certified by a certifying body for advanced nursing. And they're able to independently assess, plan, implement, and prescribe medications and medical devices for their patients. They do, however, have to have a collaborating agreement with the physician to be able to.
What does that mean, a collaborating agreement? Explain that. For example.
They need to have a physician that they have a contract with, so if there is a patient who may have a complex condition in which they feel they would need some referral or maybe some consultant, they would be able to call this physician, email, get some information from that physician to help plan out the care for the patient.
How does that help the patient?
Well, what it does is it increases the number of providers that we have, especially in our underserved areas such as in Newark, Camden, Patterson, Trenton, to be able to have more primary care providers available for our citizens. And then the physicians can focus on those more complex patients. So the nurses can focus on the wellness and maybe chronic disease management, and our physicians can focus on complex chronic disease management. So it's a great partnership between nursing and physicians to provide the needed services to our communities.
But also the other part of that, we've talked about on public television an awful lot, and our partners at NJTV News talk about this as well, the primary physician shortage. Connect for us the primary physician shortage and what you just talked about.
Absolutely. Our understanding is that there will be a significant shortage of primary care providers for a number of reasons. A lot of the young men and women that go into medical school are now preferring to specialize in areas such as orthopedics, endocrinology, neurology. So there's not a lot of primary care physicians, or what we know as the old family docs that are out there. So this is where our advanced practice nurses come into play. They focus on primary care, taking care of the family, the individual, doing wellness checks, and also being able to manage their chronic disease such as hypertension, diabetes. And if they become more complex, then she would have a referral network, or he would have a referral network that they could refer to a physician who is maybe a cardiologist, a neurologist, an endocrine
specialist.
A specialist, absolutely.
Judy, has the Affordable Care Act several years ago passed, well, let me ask you this way. How has it changed the role of nurses and nursing?
I think it's opened the field for our advanced practice nurses to be out in the community and to be able to perform primary care services. There are now more patients who are on insurance plans, so that also helps with patients seeking care, because a lot of times our patients don't seek care because they don't have insurance, and they wind up in our emergency rooms at a really crisis time of their disease, and the cost to take care of that patient becomes exponentially more expensive. Whereas if we have our nurses and our insured patients together working in the community, maybe we could prevent that disease from becoming a more chronic, complex condition.
Which was the intent from the beginning, to deal on the wellness side. How about this? The State House down in Trenton. There are obviously 50 state houses across the country dealing with a whole range of issues. But the question is, in New Jersey, what initiatives, what efforts are going on that would potentially impact nurses, nursing, and the interaction with patients?
Well, we do have a consumer access to health care bill that's in both the states.
What does that mean?
What it is it's looking at that contract or the collaborating agreement to eliminate it so that nurses can more independently practice, so they can open up their own practices, not to have a strict contract with a certain physician that they could really refer or consult with any physician that they would like. So if a contracting physician wasn't available, oftentimes the nurse doesn't know or doesn't have a referral network. So it would be great if we could have that collaborating agreement removed. So that would open up more nurses to be able to do primary practice.
Devil's advocate, what happens if a physician or the physician community says, hey, wait a minute, a nurse, he or she may be great, but they need us to sign off on that so we know everything's playing out the right way? You say?
I'm saying that our nurses are educated. Again, master's prepared, in a lot of cases, doctorate prepared now, so they are able to.
These are advanced practice nurses. I'm going to be clear.
These are not registered nurses who you see day to day in
RN.
nursing home or in a hospital setting. These are advanced practice nurses who are going beyond their registered nurse licensure and getting educated and certified to be able to take care of patients independently. Now, if there's no collaborating agreement, nurses are still going to say, if this is a complex case, I need to refer this to a specialist, or I need to consult with the specialist for the best plan of care for this patient.
So ultimately, being patient-centric, you're convinced that this will provide better care for patients?
Absolutely. I think with nurses involved in healthcare, especially in primary care, we're going to start to see a decrease in chronic disease issues and a slowing down of the progression of chronic disease. We need to focus on wellness. Wellness is the least expensive way to provide health care. When we have a chronic disease, you can see as we go on with a chronic disease that the cost of taking care of that patient really rises. We get primary care, healthcare providers, physicians, nurses, physician assistants into the community to help prevent that complex care.
You know, of all the years I've known you, Judy, I don't think I've ever asked you this question, but why did you go into nursing?
I went into nursing, number one, because I like to take care of people. I want to make sure that my community is healthy. I also, as I progressed in nursing and was educated in the different aspects of healthcare, I understood that nursing was there to help keep the costs of healthcare down, to provide the needed services in the community, especially in communities that are very underserved. Nurses go in because they care.
And the most rewarding part about the nursing profession for you?
For me right now is to care for the caregiver. My role as the Chief Executive Officer of the State Nurses Association is to now care for the nurses that care for the patients in our community.
They need that care.
They need that care, absolutely. Healthcare is becoming so complex. Patients' acuities are going so tremendously high, both in,
What does that mean?
well, complex cases, more medications have to be given, more procedures are being done in hospitals, more treatments are required. Patients' plan of care is very complex, so our nurses at the bedside are struggling to keep up with what's going on in healthcare.
Last question. Nurses are leaders, no doubt. Therefore, greatest leadership lesson you've learned as a nursing professional is?
To listen to your patients. For me, as an executive, to listen to my nurses.
Well said. Thank you so much. Congratulations on a great night.
Thank you. Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by TD Bank, Holy Name Medical Center in Teaneck, New Jersey, Suez, Qualcare Inc., Choose New Jersey, NJ Best, and by New Jersey Sharing Network. Promotional support provided by the New Jersey Chamber of Commerce, the statewide voice of business in New Jersey, and by bestofnj.com, covering all New Jersey has to offer. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.